Hi, my name is Gabriela, and I have my presentation for population level health education intervention. The YouTube link is listed in this first slide due to the PowerPoint presentation being too big to upload to our course Moodle. The health education topics that I will be addressing in this presentation are diabetes, obesity, nutrition, and health literacy for the low-income community of Long Beach City. I am addressing these health education topics due to the following reasons. 10.3% of adults in the city of Long Beach are diagnosed with diabetes. Additionally, 1 in 4 adults in the city of Long Beach are considered obese. Modifying eating habits and increasing physical activity are ways to reduce blood sugar levels. Lastly, 18% of adults report speaking English less than very well. In the following slides, I will be talking about Healthy People 2020 objectives as they relate to my presentation. Healthy People 2020 increases public awareness and understanding of the determinants of health, disease, and disability and opportunities for progress. Healthy People 2020 diabetes. 30 million people in the United States have diabetes. It is the 7th leading cause of death. Some racial ethnic minorities are more likely to have diabetes. The goal is to reduce the number of diabetes and improve the quality of life for all people who have or are at risk for developing diabetes. We will achieve these goals by reducing the number of diabetes cases diagnosed yearly, increasing the proportion of adults with diabetes using insulin who monitor their blood sugar daily, and reducing the rate of death from any cause in adults with diabetes. Healthy People 2020 overweight and obesity. 2 in 5 adults and 1 in 5 children and adolescents in the United States are obese. The goal is to reduce overweight and obesity by helping people eat healthy and get physical activity. This will be achieved by reducing the proportion of adults with obesity, reducing the proportion of children and adolescents with obesity, and increasing the proportion of healthcare visits by adults with obesity that include counseling on weight loss, nutrition, and physical activity. Public health interventions make it easier for people to be more physically active. Healthy People 2020 nutrition and healthy eating. Many people in the United States do not eat a healthy diet. The goal is to improve health by promoting healthy eating and making nutritious foods available. We will achieve this by reducing household food insecurity and hunger, increasing fruit consumption, vegetable consumption, and whole grain consumption. Healthy People 2020 health communication. Effective health communication is critical to health and well-being. The goal is to improve health communication. This will be done so by increasing the health literacy of the population, increasing the proportion of adults whose healthcare providers check their understanding, and increasing the proportion of adults with limited English proficiency who say their providers explain things clearly. In the low-income community of Long Beach, I perform a needs assessment to figure out what we need to address for this community. I visited the city of Long Beach where I performed a windshield survey. I observed the environment and behaviors of the community. I gathered data and statistics to determine the community needs. And based on the data and statistics obtained, I determined the educational needs of the community. During the needs assessment, I interviewed residents of the community of Long Beach and individuals from the health department of Long Beach. Resources that I used to obtain data came from the 2019 Community Health Assessment and the census. The theoretical framework I used was Precede and Proceed model. For the community of Long Beach, the Precede model was used to provide an educational class that addressed diabetes, obesity, nutrition, and health literacy. Precede phases 1 through 4. 1. Social diagnosis. I identified and evaluated social problems that affect the quality of life of the Long Beach community. 2. Epidemiological, behavioral, and environmental diagnosis. I focus on specific health issues of the community, such as diabetes, obesity, nutrition, and health literacy. 3. Educational and ecological diagnosis. Selecting factors that, if modified, will most likely result in behavior change in the community of Long Beach. 4. Administrative and policy diagnosis. Assessment of resources, development and allocation of budgets, and looking at organizational barriers. Proceed. Phases 5 through 9. 5. Implementation. Implementation of the program, providing an educational class to the community of Long Beach. 6. Process evaluation. Developing process objectives for the educational class. 7. Impact evaluation. Developing goals for the educational class that will be provided. 8. Outcome evaluation. Developing one long-term objective for the health issues that the educational class addresses. Issues. Barriers in the community of Long Beach. There is an unwillingness to learn or change behaviors. Next, there's language barriers. English versus Spanish. Reading level. It is estimated that 30 million adults struggle with basic reading tasks. Family support. If a person does not have family support, crucial changes for necessary diet and physical activity changes will not happen. Money. Individuals in this community need to have affordable, healthy diets and places where they could perform physical activities. Resources and services that are available for the community of Long Beach. Any educational material provided has to be provided in the languages of Spanish and English. These educational materials also have to be written at a 6th grader or lower reading level. Spanish translators have to be readily available. YMCA offers classes and fitness centers to support and maintain healthier lifestyles. And Familias Unidas, United Families, is a partnership with Latino residents for pre-diabetes prevention, diagnosis, and treatment. To address diabetes, obesity, nutrition, and health communication, the following interventions were used. Diabetes. Increase the proportion of adults with diabetes using insulin who monitor their blood sugar daily. Obesity. Reduce the proportion of adults with obesity and increase the public health interventions that make it easier for people to be more physically active. Nutrition. Increase the proportion of eligible people completing CDC-recognized diabetes prevention programs. Health communication. Increase the health literacy of the population to prevent health problems from occurring or better manage health problems that arise. Teaching techniques included PowerPoint presentations, educational pamphlets, provided education using the 3 types of learning: visual, auditory, and kinesthetic, using the teach-back method, questions and answers session, bilingual classes, Spanish and English. To be successful in providing this class, I had to budget. I had to take into consideration the cost for educational materials, cost for the area to provide the class, and cost for translators. Additionally, the Long Beach Department of Health and Human Services provides a diabetes prevention and management program. They have a budget to meet the needs of the community, so I reach out to them. For the educational class to be successful, there had to be logistics put into place. I had to find certified Spanish translators. I had to come up with several class dates for the community. The Long Beach Department of Health and Human Services helped to promote the class. And advertisements of the educational class came across different platforms such as social media, newspaper, and flyers. Goals for this class are going to be talked about in the following slides. Goal number 1. By the end of the education session, 75% of the participants will be able to demonstrate how to properly monitor blood glucose levels by measuring capillary blood glucose before each meal, and at bedtime. Goal number 2. By the end of the education session, 80% of the participants will be able to identify exercise classes that can be attended throughout the community. Goal number 3. By the end of the education session, 60% of the participants will be able to identify affordable, healthy diets that will help in reducing blood glucose levels. In a year, there will be a follow-up with the individuals who attended the class to see how many individuals engage in blood sugar monitoring, diet modification, and physical activity. Project evaluation, outcome measurements. Goals for the project were evaluated by setting specific measurable goals. These goals had to be achievable and realistic based on the time frame the education session will be provided in. Success will be measured by feedback provided from the participants on the education session, percentage of short-term goals achieved by participants at the end of education session, and a long-term goal will be measured in a year after the education session by evaluating the percentage of individuals who continue to use education provided for monitoring blood sugar, diet modification, and physical activity. Results and conclusions. The 4 main health issues in the community of Long Beach are diabetes, obesity, nutrition, and health literacy. The main goals are to increase the proportion of adults with diabetes using insulin who monitor their blood sugar daily, reduce the proportion of adults with obesity by identifying exercise classes that can be attended throughout the community, reducing household food insecurity and hunger by identifying affordable, healthy diets that will help and reduce blood glucose levels, and increase the health literacy of the population to prevent health problems from occurring or better manage health problems that arise. Weakness and problems that arose while I conducted this education session for the community of Long Beach. Location of a site to conduct the teaching was difficult to obtain. Navigating and using Zoom technology to conduct teaching, and adapting to health restrictions due to the COVID-19 pandemic that we are experiencing. Future suggestions. Be able to follow the community to evaluate long-term objectives and goals. Provide confidential questionnaires to obtain statistical data, and provide educational teaching in different languages besides Spanish and English. Thank you for watching my presentation. The following 3 slides show the references that I used for this presentation. Thank you once again.